Hi everyone, happy Friday. Welcome to Mom Talks. I'm Kendra. I'm back. I'm not pregnant anymore, and I'm really happy to be with you here at the Children's Specialty Care Center, joined by Dr. John Cole with Kids Docs, our doctor for all things, all fun topics. He had flu with us last year, and now we're going to talk about something equally great, which is vaccines. Back to school time is coming back. I'm sure a lot of parents out there are making those back to school appointments, those physicals, making sure they're all in line with vaccines for their kids. And so we are here today to talk about all things vaccines. Just a reminder that we are taking questions throughout this session, so please feel free to send us whatever questions you have about vaccines and about which ones are needed for which grade levels and anything like that. We are here to answer questions. So let's start with really baseline here is when people hear vaccines, they think it's a shot. But what is a vaccine? What's in that syringe there?
Sure. Well, first of all, happy summer, everyone, and hope that you're enjoying it. And I can't believe it's already back to school time already. So in terms of what a vaccine is, the way I like to explain it to my families is this is a controlled way of introducing a challenge to a person's immune system so that they can generate a response to protect them against that illness without actually having to suffer the illness. And so what's in that shot that your child or you get is basically a component. So whether it's the actual virus that's just been killed or turned off, whether it's a protein or something from the virus or bacteria that triggers your immune system to react, what it is basically us trying to teach the immune system how to generate a healthy and appropriate response against that illness without your child actually having to go through all of the frustration and symptoms of being ill. So that is what a vaccine is in short.
And from history, these are illnesses that long ago were very problematic to society, and now we're fortunate that it's not anymore.
Absolutely. I mean, when you look back at the history of immunizations, starting with research into smallpox and cowpox and things like that, and then moving on to obviously polio was one that was well known in the mid 20th century. Polio was a scourge in this country as well as around the world. And many children, in fact, if you go to museums today, you'll see things like iron lungs and other artifacts where people who lucky enough to survive the illness had significant problems throughout their life. And so when the polio vaccine came out, that was heralded as one of the tremendous breakthroughs in modern science and health, and it really helped to turn things around. And now, other than a few pockets of polio in 3 or 4 countries around the world, we've been successful in eradicating polio and smallpox and some other scourges that afflicted mankind for centuries.
And nowadays, most people think of vaccines as kind of that natural right of childhood. Your baby gets many of them, but you get them when you go back to school, like we're talking about today. So let's just talk a little bit about what's the schedule for vaccines. Beginning when you bring a new baby.
Absolutely. So if you look at the Centers for Disease Control, and then they have a committee called the Advisory Committee on Immunization Practices, they set out a yearly recommended schedule that is endorsed by the American Academy of Pediatrics and the American Academy of Family Physicians. And what that schedule does is it tells us what to look for or what shots to do at a given age. So let's just go through it quickly. So at birth, all babies are recommended to get their first hepatitis B vaccination while in the hospital, or you can choose to do that in your doctor's office as well. The reason why we do that is because although we have hopefully improved maternal screening programs to make sure that all pregnant moms get good health care and good prenatal care, we can't guarantee that. And so hepatitis B being an illness that can pass from mother to child, it's really important for us to know that babies are protected and that they have that ability to prevent hepatitis B transmission. So hepatitis B is recommended universally at birth, and then again around 1 to 2 months of age, and the final dose is recommended at 6 months of age or older. So when you come in to see your doctor, typically you'll have had that first vaccine done in the hospital if you choose to do so, When you come in for the 2-month-old visit is when most pediatricians and family physicians will start the routine immunization schedule. And what that involves is it involves getting the baby's first immunizations against illnesses such as diphtheria, tetanus, pertussis or whooping cough, polio, pneumococcal disease, and rotavirus. So those are the common vaccines that are done at 2 months. We repeat those at 4 months, 6 months, and then we finish off the pneumococcal, the DTaP, Hib, and polio, at least for the early childhood series, at 12 to 15 months of age. At 12 months of age, that's another big milestone. When your baby turns a year old, we recommend getting the first measles, mumps, rubella vaccine and the first chickenpox vaccine as well. Hepatitis A can also be done at the 12 to 15 month mark. And then basically from that time on until your child gets to kindergarten age, we're basically just finishing up those series to make sure that your child has the complete vaccination schedule so that they have the best chance at having immunity against these illnesses. Right now, obviously, the MMR is being talked about a lot because of the number of measles outbreaks that are occurring around the country. And measles is a very serious illness, and unfortunately, not only in this country, but around the world, we are seeing significant increases in illness. And unfortunately, in Europe, there have already been some deaths reported because of measles. So again, that's why it's so critical to get those vaccines done on time per the schedule that's recommended by pediatricians and family physicians according to the CDC.
You know, my family has the 2-month visit coming up with our daughter.
Yes.
So, and moms out there, you'll know the feeling whenever I say my husband will be taking her to that visit. So let's talk about, you mentioned the schedule, but you know, there are certain vaccines that the kids have to get, you know, entering certain grade levels to go back to school.
Absolutely.
What are those?
So every state is different. So unfortunately, as a pediatrician, I wish that all the states would follow the CDC recommendation exactly. But let's take Missouri, where we're based here, for instance. In Missouri, by state law, a child has to have diphtheria, tetanus, pertussis, polio, hepatitis B, measles, mumps, rubella, and chickenpox vaccine prior to entry into school. So we're usually talking about kindergarten age. If you're moving from another state, obviously your doctor will check to make sure, and your school nurse will check to make sure that you're compliant with the state regulations. As a pediatrician, I go the step further and recommend the schedule that is recommended by the CDC and the American Academy of Pediatrics, because that is the most complete schedule and it will comply with any state laws that are out there right now. But those are the ones that are required. And so most of those are done in early childhood, like we talked about, but the ones that you would hear about getting before you go back to kindergarten, or start kindergarten, I should say, is you need the final dose of the diphtheria, tetanus, pertussis, and you need the final dose of polio, and those have to be done at age 4 or older. So no matter how many doses you had prior to that, you have to have the final doses done at 4 or older in order to qualify and be ready for kindergarten. The MMR and chickenpox are also typically done at 4 to 6 years of age to give you the second shots, but they can be done earlier, and now the CDC, especially for families that travel internationally or they're in outbreak regions, they are recommending getting those second doses done earlier to make sure that your child has adequate protection. So again, those are the most common ones that parents will hear about when they go back to their doctor's office in order to get their child ready for kindergarten or school.
What about like an adolescent?
Right, so as a teenager, there's a couple of other vaccines that we talk about. So in Missouri, the two that are required before you start 8th grade is you need at least 1 dose of the tetanus, diphtheria, pertussis, or Tdap booster, and then you need the first meningococcal, so meningitis vaccine, and that is Menactra or Menvio are the names that we hear about. Those are done typically at the 11 to 12-year-old visit per the CDC schedule, but again in Missouri they have to be done before you enter 8th grade. And then in meningitis we usually do 2 doses, and the second dose is done 16 to 18 years of age, but again before you enter senior year of high school. So those are the vaccines that are most commonly talked about in the adolescent period. One other vaccine that is not required for school, but that we strongly recommend is the human papillomavirus or HPV vaccine, which you've heard is called Gardasil. There's also another one that's escaping me right now, but those vaccines are done, recommended starting at 11 to 12 years of age, going up to age 26 now for both men and women. That changed just recently. And that is to prevent cancer later in adulthood from a few of the HPV subtypes. Cancers that we're talking about: cervical cancer in women, penile and anal cancers in men, head, neck, and throat cancers in both men and women.
One thing that I've been hearing a little bit about, just, advertising in the news and things like that, is meningitis, talking about meningitis for college students.
Yes.
Why the push? Why do we talk about that with college age students?
Excellent question. So meningitis is an illness that can be spread very easily. It's usually spread through droplets in the air. And so the concern about college students in particular is that when we have them living in these close quarters in dormitories, it is easier to spread the illness. And so besides the meningitis vaccine that's recommended for high schoolers, which is basically covering 4 strains of bacterial meningitis, so A, C, W, and Y. We're not going to test you on this later.
Oh my goodness.
But A, C, W, and Y are 4 strains. That's included in the meningococcal vaccine that is done early. There's a 5th strain of meningitis called meningitis B that is not covered in that vaccine but has its own vaccines now. There's 2 of them on the market called Trumemba and Bexsero, and those are available typically starting at age 16 up to around 23 years of age. In our practice, we will typically recommend doing that when the child is either entering the senior year of high school or the first year of college, because at least the data thus far has not shown that it's a long-lived vaccine in terms of it doesn't last many years. And so we want to make sure that we target that vaccine to young people who are going to be at higher risk, which includes college dormitories or other like situations.
And for entering college, am I correct in assuming that colleges want you to be all up to date on everything?
The colleges are becoming, the colleges are becoming more stringent about the requirements to get in. Now again, for some colleges, the meningitis B is becoming strongly recommended, if not required, but it's still not required like some of the other vaccines. But most colleges definitely want you to have your measles, mumps, rubella, and your chicken pox, or proof of immunity if you had chicken pox as a child. They will want to see your hepatitis B. They will want to see the diphtheria, tetanus, pertussis, and all the other ones we talked about. So those are common ones, but meningitis is definitely one that they are concerned about because of the potential for outbreaks on campuses.
Just a reminder, we are taking questions. There's a lot of information out here right now, so if you have any questions, we haven't covered something that you feel like we should be talking about, make sure to go ahead and type that question in and we will get to it. So one thing that, I was actually just thinking about this the other day is the chickenpox vaccine. It used to be that chickenpox it wasn't a question of if you were getting it, it was when, and you just had a lot of Comline lotion on hand, you just dealt with it. Not the case. In fact, I was hearing there used to be chickenpox parties where
there still are. Absolutely.
Just get them all together and they all get it and then they get immune to it. But probably not a good idea in this day and age when there's a vaccine available.
So I think that there's a lot of discussion going on, and it's a good discussion, but I think we need to make sure that we always refer back to what is truth and science proven. We know that I had chickenpox when I was a kid. I know that families, my parents probably had measles. And there's a lot of illnesses that many of us in the older generations had when we were younger, and we survived them. And so the thought is, natural immunity is great. We should do that and not do all these things. The problem is that while most people do okay, there are a significant number of people who suffer real serious and sometimes deadly complications from these illnesses. So for chickenpox, there's been a lot of questions about should we do chickenpox parties and just let children get natural immunity? That's the best way. Well, there's 2 problems with that. The first problem is that your child may do just fine and do what most people do and get the chickenpox, and then they recover, and then they have lifelong natural immunity. But they also now have the possibility of developing shingles later in life. And we know that about 1/3 of adults can get shingles. And shingles, if you've had it, is extraordinarily painful and problematic, and the issue is that it doesn't always go away quickly. So for some people, they deal with what we call neuralgias or pain for years after having shingles. And so if you could prevent that in your child, to me, that makes sense. Not only protecting their health short term, but protecting them long term. The other issue is that not every child who gets chickenpox does great and does fine. Chickenpox can lead to severe bacterial skin infections. It can lead to pneumonias and pneumonitis, and it can cause encephalitis. So there are lots of complications. Thankfully, they're not as common as we could see them, but they are. If your child is the one affected, it is a serious problem. And so, again, going back to what I was talking about before about what are vaccines, there's nothing magical about them. All we're doing is, in a controlled way as scientists, introducing a challenge to the immune system to let it learn and grow and develop and produce decent immunity without making the person suffer through the illness. So you think about the pain for a few seconds from a shot versus potentially a lifetime of complications. That, to me, it's playing the odds and putting those odds in your child's favor. So that's why I personally recommend against chickenpox parties or trying to get children sick on purpose, because I just feel like that's kind of being cruel to the child. And second of all, I feel like you don't always recognize what are the potential issues that you may be setting yourself up for later and your child for later. You may not be in the picture 30 or 40 years from now, but your child will be dealing with the consequences of the decisions that are made for them. So that's why I believe it's really important. If we can protect them early on and protect them later on, we should do that as parents.
Obviously, vaccines, have been in the news a lot, and there is a large anti-vaccine movement going on right now with parents who believe that vaccines just aren't safe or are could be harmful. Can we just talk about it? Let's just be straight. Are vaccines safe?
Absolutely. Vaccines are safe. Now, the first thing I'll tell anybody in the world, I think that we have to be truthful as scientists. Nothing in medicine is perfect. Nothing in medicine is guaranteed. And so, are there children who could potentially have allergies or side effects from vaccines, like any other medication? Yes. Is that rare? Yes. We are talking about serious complications from vaccines being literally less than 1 in a million. So the common things that they like to talk about on the news, which are absolutely true, is you have a greater chance of being struck by lightning, you have a greater chance of being killed by a shark attack than you do of being harmed seriously by vaccines. But as a doctor, I never say never. So what I tell people is that's why it's important to have a good, trusting relationship with your physician, and hopefully your physician is practicing evidence-based medicine and following the recommendations that thousands of scientists around the world have worked on to make sure is the most effective treatment for our children. Again, when I look at all sides of this discussion, I think the first and most important thing is not to demonize each other. I think it's really important that we talk and answer the questions and concerns that families have, because obviously anytime you go to your doctor's office seeking care and treatment, you're putting your trust in that person, and you're hoping that that person has the education and the experience and the wisdom to give you the best advice for your child. Personally, myself, I want to make sure that I'm following what is the most scientifically sound and evidence-based practices that are out there. And based on that, when we look at the history of health, vaccinations are probably in the top 3, if not the top 5, greatest inventions that we've ever seen that have impacted public health in a positive way. Next to clean water, sanitation, safe food supply, antibiotics, those are probably the top 4 or 5 things that have really made a difference in people's health around the world.
And I'm sure that from time to time, you get folks that come in with their child, and you can just tell they're nervous.
Right.
Like I said, this has been out there a while. Right. What do you say to parents who are concerned?
Absolutely. The first thing I tell parents is I want you to ask questions. I want you to express your concerns, and then I hope as a doctor, and I hope other doctors will do our very best to tell you and share with you why we believe what we believe, why the evidence is so strong in this regard. Because if you can't communicate with your physician and you can't share what your concerns are about, I think that leads to mistrust, and it leads to a lot of bad relationships, and especially if something was to happen that you were worried about, then there's a lot of finger pointing and blame that can go around. So as a physician, I have always believed that it is incumbent on us doctors to do a good job of communicating with our patients, to make sure that they understand why we are recommending what we recommend, to make sure that they understand what the benefits and the risks are, and to make sure that they feel comfortable that they are participating in that decision. So I would never force somebody to do something that they don't want to do, but then I'm honest with them and say, maybe I'm not the best physician for you if you strongly believe something that I cannot recommend or don't think is safe for your child. So when it comes to immunizations, again, I think it's important for us to have an honest discussion, to make sure that we understand people's worries and concerns, and to address them the best we can. Now, having said that, there are some people that are just going to agree to disagree, and that is okay in one sense, in that we respect everybody's viewpoint. The one point I'll make about immunizations that I think gets lost sometimes is whether we like it or not, as citizens of a country, we can't just worry always about what my right is or what I think I should be able to do. We do have a civic responsibility to the community at large. That's why we have traffic laws. That's why we have laws about not stealing, not murdering, not doing anything else, because we have responsibility to our fellow citizens. And a lot of these illnesses, all of these illnesses that we protect against, they are communicable diseases. That means they can spread, and they do not have an agenda, they do not have politics, they do not have philosophy. They are simply germs that are out there to infect, and unfortunately, they can kill sometimes. And again, the germs aren't looking to kill anybody. They don't have emotions and feelings like we do. But they are living creatures, and they have the ability to do severe harm. And I think it's really important for us to realize that there are many in our population who, because of health issues or illness, like cancer and chemotherapy or immunosuppression or HIV/AIDS, cannot get some of these vaccines like the measles, mumps, rubella, or the chickenpox vaccine. And so they are at increased risk. And it is our duty as a society to help protect the weakest members of our society. Otherwise, it can come back and harm us, because even if we're immunized, even if we have natural immunity, sometimes nature can find a way. And what happens is if it takes root in a community, it can spread, as we're seeing with the measles right now.
I see that, sometimes in mom groups online or things like that, where moms say just, if your child isn't vaccinated, I don't even want them playing with,
right.
My child or things.
Right, and that's what I really get saddened by that, because what I'm seeing more and more is a real division in communities over this discussion, where I really don't think there needs to be that division. I want to respect people's rights to make good decisions for their family, for their children especially, because as parents we have no higher responsibility. But at the same time, things that I do with my child may or may not impact others. And so I have to think about that and weigh that. So when I have my daughter, who is almost 16, out in a community where there are babies, where there are young children who maybe haven't gotten immunized yet because of their age or because of their health conditions, I take pride in knowing that I have done everything to not only protect her, but to also protect the community at large. And again, it comes out of that sense of civic responsibility that I hope we still have, but honestly appears to be getting lost with some of our discourse today.
when you're talking to parents about getting vaccines for their children and stuff, some might ask about, is there going to be any kind of side effect other than just
Absolutely. So the biggest things that I tell parents, and we always provide a sheet from the CDC that explains these as well, because we want parents to be fully aware. But the most common side effects that we see are children can have some fever a few days after the vaccine. The MMR and chickenpox are exceptions. Sometimes the fever doesn't show up till 7 to 14 days later, so you have a delayed response. And then there's always the redness or swelling at the site of injection, in the arms for older kids, down in the thighs for the little babies. And then some fatigue or malaise. They just don't feel quite themselves. For babies, they may not eat well, or they may be a little fussier for a day or so. For older kids, they just may feel more tired. But the good news is those are very short-lived. They go away. And then you've taken a short-term, pain for long-term gain, because now the child has a better chance at fighting off illness and disease than they would if they were not immunized. And what's really interesting in some of the research that's coming out now is we're seeing that even immunizing with things like getting the MMR vaccine not only protects against measles, mumps, rubella, but it can help boost your immunity and protect you against other things as well, because your immune system is being challenged. We don't know exactly how that works yet, but it's interesting to see that the immune system is such a greatly designed system in terms of it knows how to react even from the moment that a child is born. It's ready to take on as many comers as it's presented with, because unfortunately we do not live in a sterile world, and luckily the human population has thrived despite that fact. But certainly in being able to be protected and our immune systems to be functioning with all systems on go is a big help.
Dr. Cole, thank you so much.
My pleasure.
That is going to wrap up our talk on Mom Talks this Friday. Thank you so much for joining us. We are back here with you next Friday at 11. Have a great day, everyone.